Hi, my name is Dr. Dmitry Tsvetov, and today we are going to revisit the topic of dental implants. The reason I would like to revisit that topic is because recently there have been a number of patients who came to my office with a very similar problem. They have had a missing tooth for a long time, and this missing tooth was restored with a bridge. And 10 years down the road, they're coming in because their bridges are failing. And so what I would like to discuss with you today is other options to restore a single missing tooth. So let's start by looking at the difference between a dental implant and a bridge, and we can discuss in more detail as far as which option is the best. So when we look at this picture right here, we see that a dental bridge is basically a fixed, which means non-removable prosthesis that gets placed onto the adjacent teeth, and these adjacent teeth are located on either end of the missing tooth. So what you're essentially doing is you're turning a one-tooth missing problem into a three-teeth problem, because in order to fit a dental bridge, you are having to cut, what we call prep, the adjacent teeth. In the process, of course, you are removing vital normal tooth structure, and you are placing this prosthesis on it that is incredibly difficult to keep clean, because you cannot brush and floss around it in a traditional way. So as a result, what you have 10 to 15 years down the road is what we call recurrent decay, which means dental caries starting at the margins right over here, where it's most challenging to keep the area clean. Now, in addition, right in the space where you have a missing tooth, you also have ongoing loss of bone. And the reason this happens is because typically once the tooth is lost, this particular area is no longer getting what we call mechanical loading with chewing forces. And so the body feels that, well, there's no reason to maintain or to keep that bone right over here because there is no use for it. So the body tries to conserve energy, and it tries to melt that bone away. Well, that creates a problem, because if sometime down the line the patient decides that they do want to get an implant there simply may not be enough bone in the area to have a dental implant placed. And as you're going to see, that actually becomes a huge issue, because if the bridge fails, then your second go-to option is the dental implants. So, in my opinion, a better way to go in a clinical situation where you have a single missing tooth is to go with a dental implant, which is basically a titanium post that gets placed into the jawbone. You're treating a one-tooth problem with a one-tooth solution. This is a simple, predictable way to replace a single missing tooth. You don't have to touch the teeth on either end. They can remain as they are, and it's a lot easier to clean around a dental implant than it is around a dental bridge. And last but not least, but definitely very important, is the fact that the bone that is maintained with the placement of the dental implant stays there for a very, very, very long time, as long as you maintain good oral hygiene around that implant. That bone is not lost. So in my opinion, when you look at both options, an implant is definitely a better way to go. So again, just to reiterate, on average, a bridge has a lifespan of about 10 to 15 years. If a bridge fails, adjacent teeth fail as well, as you're going to see from the subsequent examples, and this leads to more treatment. Problems with hygiene definitely lead to recurrent decay, which is why adjacent teeth fail, and you may need additional treatment like root canals and or extractions on those teeth, and again, you're turning a one-tooth problem into a three-teeth problem. A dental implant, on the other hand, it allows you to solve a one-tooth problem with a one-tooth solution. It achieves predictable clinical results and stability. It's a lot easier to keep clean, and it maintains the bone. So let's look in more detail at the problems that dental bridges can cause. Here's an example of the patient that originally started having a single missing tooth right over here. This problem was initially solved by giving a patient a dental bridge from the first right maxillary molar to the second premolar. As a result, as you can see over here, 10 years later, both of these teeth fractured, leaving the patient quite in a predicament because these other two teeth are at this point non-restorable. So the only thing that can be done for this patient at this point is extracting those bad teeth and placing 3 dental implants to replace the 3 missing teeth at this point. Keep in mind that if the decision has been made to originally replace the 1 missing tooth with the 1 implant, those 2 other teeth would still be intact and they would still most likely be in place. So at this point, instead of originally paying for 1 single implant, this patient is now ending up paying for the bridge, as well as 3 additional implants, as well as 3 additional crowns. So hopefully, as you can see from this particular example, going with a single implant to replace a single missing tooth is definitely a cheaper overall option, and it's a more clinically advisable option. Let's look at another example where you have a patient with a failing bridge on the upper left. You have a cracked tooth right over here, and you also have recurrent decay around this tooth over here. The dental bridge was placed because the patient had a missing premolar right over here. Again, what we ended up doing is we ended up creating a 3-tooth problem because these other teeth have at this point failed as well. So we have no other choice but to remove these teeth and to replace them with the dental implants, as you can see over here. Again, it's a problem that would have very easily been resolved had this 1 missing tooth been restored with 1 implant, because again, at this point, this patient had to pay for the bridge originally, and at this point for 2 more implants and for 2 more crowns, which again, originally he could have only paid for 1 implant. So here's a closer example. This is the picture of the same patient with the 2 implants and the 2 abutments in place, and then this will be now also restored with the bridge. Here's another situation where a patient presents about 15 years after the placement of a dental bridge for this missing molar tooth right over here. You see recurrent decay around one of the premolars. Of course, if one of the what we call abutments for the bridge is broken, which it is right over here, you have to cut the bridge right over here and extract this tooth. And the only way to restore now this missing space is to place 2 more dental implants, which is exactly what we did, and this patient will end up with 2 additional crowns. So let's look at the examples of how a single tooth situation is better managed from the beginning. We have a patient here with a very decayed maxillary first molar. It needs to be removed. When it is removed and bone grafted and the site has healed, we placed a single dental implant, and long term this will definitely give the patient a much better clinical prognosis long term. Here's another example where this patient lost the mandibular first molar tooth. The tooth was removed, and instead of doing a bridge and cutting 2 perfectly normal teeth, we ended up simply placing a dental implant, which will then allow this patient to have a dental crown, which is very easy to clean around. And here's a closer look at that same patient. Again, the teeth on either end are completely fine. There is definitely no need to cut them for a dental bridge. And here's yet another situation where a single missing tooth is restored with a single dental implant. It's a simple, elegant solution to a single missing tooth. So I would like to to close by mentioning that here at Temecula Facial Oral Surgery, we offer completely free dental implant consultations. So if you have a situation where you have a tooth that needs to be removed and you would like to know what your options are as far as restoring that tooth later, or even if you've been missing a tooth for a while and you would like to have it restored with dental implants, please give our office a call. We would love to see you for a consultation, which includes x-rays, CT scans, and whatever else needs to be done in order to provide you with the information that you need. We hope you give us a call, and we're looking forward to welcoming you to our office. Thank you so much, and we will see you soon. Bye-bye.